Hi everyone, I'm Catherine Beauchemin. I'm partner at PeriPharm, a consulting company that specializes in market access and pharmacoeconomics in Canada. I'm really pleased to be here today with my colleague Maggie to present you the results of a study we had the opportunity to conduct on the market access challenges for innovative medications in women's health in Canada. So this research was made possible through an unrestricted grant from Duchesnay, a pharmaceutical company that is dedicated to improving women's health. So as you may already know, the market access in Canada is a complex process that involves multiple stakeholders. So to give you a brief overview of the market access pathway, once the clinical trials are completed, the approval and reimbursement process begins with the regulatory review by Health Canada. So Health Canada is responsible for assessing the efficacy and safety profile of a new drug to determine if it can be marketed in Canada. Once a notice of compliance is granted by Health Canada, then the HTA process begins. So in Canada, there are two public HTA agencies. So HTA is for Health Technology Assessment. In Canada, it's the CDA, AMC, and ENICE. The role of these agencies is to assess both the clinical or the therapeutic value of a drug and the economic value of a drug. And it is also to provide recommendations regarding the reimbursement of new technologies or new drugs. Typically, when CDA or ENICE recognize the therapeutic value of a drug, they also recommend to reduce the economic burden of the drug based on the cost-effectiveness results. At this stage, there's a negotiation process with the PCPA. So the PCPA is the organization that is responsible for negotiating a price of a drug with a manufacturer on behalf of the provinces. Once a successful negotiation is reached and an agreement is reached with the PCPA, well, each individual province make its own decision on whether including the new drug on their public drug formularies. So it's really an overview of the process. Here is the estimated timelines for Canadian drug review and reimbursement process. The entire process takes about 2 years, but it can be shorter or longer for certain products. It is important to note that some of these steps can occur concurrently, and it's possible to do the submissions to the payers prior to receiving the NOC in order to accelerate the process. So the objective of our study was to generate quantifiable and tangible evidence on the access to innovative women's health products in Canada. So to achieve this, we first conducted a targeted literature review to identify a list of women's health conditions. Then we identified all drugs with a specific indication approved by the FDA for the conditions of interest. This research was over a 20-year period, so between 2003 and 2023. So we among the products that were approved by the FDA, we assessed the number of products that were also approved by Health Canada. For products approved in Canada, we examined the submissions to public payers, CDA, AMC, and ENICE, and we also examined successful negotiations with the PCPA and listing on the provincial drug plans. In parallel, we also examined the number of products that are covered by the private payers.
So I'm going to go into more of the results of our study, and there will be a lot of numbers, so hopefully I can keep everybody awake here for all the numbers to come. So what we identified through our literature research is that we found a total of 38 women's health conditions, of which 10 of them had drugs approved by the FDA associated with them. These conditions included those such as menopause and the associated symptoms, postmenopause, going to contraception, heavy menstrual bleeding, uterine fibroids, endometriosis, so all of these conditions that we're very familiar with, and going all the way down to pregnancy and a lot of the symptoms and conditions associated with pregnancy, for example, postpartum depression, which is like a lot of the brain health that we are talking about right now. In total, FDA has approved 45 medications for these conditions in the past 20 years. However, if we see the column for Health Canada approved 24 of them, which is about 53%. And some of the conditions, such as heavy menstrual bleeding, there is contraceptives, as well as endometriosis. There are all of these medications that were approved in the US are also approved in Canada. However, there are drugs such as, there's one for uterine fibroids, and there are all of the 4 medications for vaginal infections are not approved in Canada. In addition to having less medications approved here, we are also lagging behind the US by about 2 years in general. There are very few drugs that are approved in Canada first. Even in the most common indications seeking Health Canada approval, such as menopause, postmenopause, contraceptive, we still only approved about 60% of the medication compared to the States. And what we also wanted to highlight here, I think this is the crowd for it, is that the FDA-approved medications, a lot of them are developed by small, innovative, specialized companies. This is not true, but it's to say that there is they may not have necessarily the capacity to expand into the Canadian market, so there is definitely an unmet need here. What is encouraging is that most of the drugs that were approved by Health Canada has so far been submitted to a public HTA agency, either to the CDA-AMC or ENICE or both. There are only 4 drugs that never been submitted to public review. And following the public review, the evaluation, we were talking about pricing negotiation, which is a newer process in Canada, and it mostly applied to the drug that went through the CDA-AMC pathway. And there are so far 7 drugs that went through this process, and only 4 of them actually concluded with an agreement with the participating drug plans in the PCPA. So when CDA and ENICE are reviewing their drugs, their recommendations are mostly aligned from our research. And what we found is that for CDA-AMC, however, they really like to recommend with condition of economic condition, that include price reduction. And these price reduction ranges somewhere between 21% all the way to 93%. And this is to either match for the new drugs, the price of the new drug to match the individual components of the drugs that are already listed, or to match the lowest dose of the listed drugs. But sometimes this lowest dose doesn't necessarily make medical sense because that's not the dose that you're actually necessarily used in clinic. These type of like really extreme price reductions really led to the drugs not have an agreement during the PCPA pricing negotiation and ultimately not being reimbursed by public insurance. With the complexity of healthcare access to medications in Canada, each individual province makes their own decision. And we're lucky in Quebec. Quebec has a different process than the rest of Canada, and we see here that in Quebec, we had the most number of drug listed. That's the dark blue number. But here we are in BC. We're in Vancouver. BC is also, we know that it's the first province that offered universal contraceptive, but BC does not have the greatest number of medications for women's health covered with no restriction. Here we really wanted to highlight that this is a long process, and it's very long for women's health product. Regardless if you are going through the CDA AMC pathway or the ENICE pathway, after you received your notice of compliance, it takes about 3 years in total to get listed on one of the biggest 4 provinces. But if we look at a publication by the Conference Board of Canada, medications in general only take 2 years in Canada. So every drug for women's health takes about a year longer. How do we get the best care? We need private insurance, but not everyone have private insurance. Women are known to be more involved in self-employment. They may have more tendency to work part-time. They are not eligible for employer-offered benefits. And this leads back to women needing more publicly reimbursed options. And going back to the top of our talk today. So I'm just going to summarize here that there are less than 60% of medications in women's health conditions that are approved by Health Canada, which are also approved compared to the FDA approvals. Most drugs that are approved by Health Canada were submitted to HTA review, but the review result had created barriers to access due to price negotiation. And lastly, I think the most impactful one is the fact that the public access timeline for women's health medications are in general 1 year longer than the other innovative medicines in Canada. So with that, I'm going to pass it back to Catherine.
Yes. Thank you, Maggie. So, well, as a take-home message, women's health in Canada is an underserved area. In order to change the current landscape and potentially reverse this decades-long trends, it is crucial to raise awareness among decision makers about the substantial impact of women's health condition on their health and their productivity. It is also essential to have continued education and support for the healthcare professionals in women's health in order to promote patient-centered, stigma-free counseling and to improve the overall quality of care. Also, it is critical to address the current HTA framework to better recognize the added value of innovative treatments in women's health and to support the introduction of novel therapies in Canada. Lastly, greater consideration of the patient perspective is needed during the HTA evaluation and the negotiation process. So our study can be used as a call to action. It is essential to prioritize these key changes in order to ensure timely access to innovative treatments for Canadian women. So thanks everyone, and we'll be happy to answer any questions.